I want to share with you what I shared with a recent Grand Rounds audience about a change that we could make in all of our medical systems that would improve patient experience. It's a change in a part of the system that is in every healthcare system. Doesn't matter where you are in this country, I guarantee you that it is part of your system because it has been a part of the system for as long as I know, even when we did paper charts. I think it's taken for granted that it's there because that's the way it's been and that's the way it always has been. And we haven't looked at it because we haven't considered there's a problem with it. This is why people often hire me to speak or to consult because I have that perspective. Because, yes, from the healthcare side of things, it doesn't seem to be a problem. But from the patient side of things, I have stories of where it has caused problems and has endangered patients as well. And so if you're wondering what this thing is that is definitely part of your system, that has been part of your system, again, as far back as any of us can remember, that has not been assessed or reassessed of why it's there, why do we need it, where do we need it, and all of those things, I'll share with you this. In these three scenarios, all three were caused by the same problem. The first scenario was a patient who was checking in for their outpatient appointment, part of this healthcare system for most of their life, did not typically get misgendered, but all of a sudden misgendered when checking in. So got misgendered while checking in, and the rest of the line got to hear it. The second scenario is an inpatient who went every time she received her food from food services would be misgendered, even though everyone else that had been taking care of her did not misgender her. Food service every time would misgender her. And then the third one is a patient that got a call from the hospital from a person. It wasn't automated, it was an actual person calling to do a survey, ask some questions about something. This patient had legal name changes and had received their gender affirming care from that institution for over a decade. And they called and continued to misgender the patient with their pronouns. All three things, inpatient, outpatient, whether by phone or whether it was food service or person checking the patient in, regardless of how long a patient had received care within that medical institution, it did not matter. All three examples of misgendering happened for the exact same reason. That reason is the sex that is written everywhere. The patient's sex that is written on their ID bands, the patient's sex that is written on their screen when they check in for everyone to see, whether it is the person greeting them, whether they have direct medical care with that patient or not. If they work within the system, the main screen for the patient that shows their name and their date of birth will also show every single person within that healthcare system the patient's sex. Now, why is that a problem? Well, I've already told you a little bit. It leads to misgendering because many times people look at that and just assume that someone's sex is their gender identity and assumes pronouns based on that. That is what happened with the food service person. That's what happened to the person making the phone call. Even in some of these stories, in some of those cases that I told you, the check-in place, even when they have asked for gender identity, a lot of times that information may be on the screen, but where it is on the screen is not in a place where the person either hasn't been trained or not easily accessible for them to look at. We are creatures of habit. So when we look at a screen, we tend to look left to right. We tend to start at the top and we tend to look at the same things every time. And when we're in a hurry, it's going to be the same few things. And so most of the time people are going to look at sex and not the gender identity. So it leads to a lot of misgendering. It also puts patients at risk because it could out them. You have somebody's sex on their bracelet, people can see. Also, in that example of a patient checking in when there's a line of people and other people around. Now, does it necessarily indicate to everyone in line that the patient is transgender? Not necessarily, but some people might get curious of why did they use that pronoun? Did they just misspeak or something else going on? Let me take a closer look at that patient. It might just draw attention. The other thing I've had patients complain about, and this isn't just transgender or non binary patients, it can be cisgender patients that present themselves in a non conforming way. They get a funny look from the person checking them in. I've heard this story many times. I know patients will tell me, I know when the person looks at the sex because all of a sudden their body language changes. They might look at me funny, etc. Now, some people handle it just fine. And it is the patient's perception. I will give you all of that. But it affects the patient's experience within your healthcare system. The other problem that it causes is sometimes in healthcare systems, we use the sex and we color code things. I've heard of some healthcare systems that on their patient boards will color code it based on sex so that they know the sex of the patient just by the color that showed the name shows up as on their patient board. Or sometimes with newborns, they will color code the cards that their name appears on. And that can be a problem because we assign sex or sex gets put on the documentation for birth certificate, correct? But we don't put gender on that birth certificate. That is up to the parents what they want to do about that child's, that baby's gender. If they want to assume a gender, that is their option. But there are also a subset of patients that are going to raise their children in a gender creative way, which also means they may not want their family members to know the sex of that baby. And so when we color code things on the bassinets or any other part of that baby, we may be revealing information. We may be revealing medical information that those parents or guardians or adults have not given permission for you to disclose because we color code sex. So there are a lot of reasons why it may not be in our best interest to have sex indicated in all the places that we have it for all the people to see it. So we have to stop and think, why do we need to know the sex of the patient? Now, if you're thinking I'm saying that we don't need to know, no, I'm not saying that at all. I'm saying who needs to know and when do we need to know? And in order to know when do we need to know, we need to understand why do we need to know? Now, I think the reason that sex is everywhere on the chart and has been forever and not been assessed or reassessed, we've taken it for granted that that's the way it is and that's the way it always has been. The reason it has been that way and always has been that way is, let's be honest, as a society, we considered sex as an identifier. We have it on our driver's license and so forth. But as I've said before, when we know better, we do better. And we know that sex is based on biological characteristics, chromosomes, internal and external anatomy, genitalia, and hormones. And I don't think the person checking us in are checking those things. I don't think the person delivering food are checking those things. I don't think many people that are in contact with the patient's homepage are checking on those things. But yes, in the past, we used to think, well, if we know the sex, then we know what the patient's going to appear like. But again, when we know better, we do better. Sex and gender are not the same thing, and sex and gender are different than gender expression. This is where those patients that may not be gender conforming in their appearance, even cisgender patients who may express themselves in a gender nonconforming way, talk about getting those funny looks. And again, begs the question, who needs to know the sex? The second answer I often get is it's important to know in case of an emergency. We need to know what anatomy is there. And I want to question that for a second. Does knowing the sex tell us the anatomy that's there? sometimes, but not always. It calls an assumption of what's there. It doesn't necessarily tell us what's there, right? And what I mean is one time it was a cisgender patient complained that they had gone to the emergency room with some sort of abdominal pelvic pain of some kind. And the ER doc, I gather the sweet ER doc was trying to reassure them and let them know that they were going to take really good care of them and check them head to toe to try to get to the bottom of their pain, and was just listing the things that they would assess. And one of the things they listed was the patient's ovaries. Make sure there wasn't an ovarian cyst rupture or something along those lines. Right then and there, the patient got very angry with that doctor because they didn't have ovaries. They had been surgically removed. That F on the chart did not help the provider know the history and the anatomy. So no, in case of an emergency where a patient can't answer you, does not always tell you what the anatomy is, and not every emergency requires you to know the anatomy of the genitalia either. Just saying. So what does all of this mean? What all this means is it's worth a reassessment. This is an antiquated system. It doesn't mean it's wrong, but it was created at a time where we didn't understand sex, gender, and gender expression. I would offer that the transgender community understood it just fine, but we and the healthcare system and much of society did not understand it. So understandably, it's part of our system, but we have the opportunity to reassess. We have the opportunity to do better, because progress is not just created by doing new things. That's important. Research is important. Discovery is important. But what is also important is not to forget our reassessment of what we already have to improve the quality of what we already do so that we can continue to build upon it, so we can continue to make sure the foundation that we have originally created is strong and up to date. So my recommendation for you is to reassess. Think about who needs to know the sex of a patient, why, when, and create a system around it. Now you might be saying, Shannon, I'm just a physician. I don't have any say-so. And even when I gave this grand rounds, I thought no one in this room is going to be able to make much of a difference in this, because this is a higher up decision making, but I wanted them to understand the patient's experience and how that might affect the patient experience as they're in the system before they even see them. And so I talked about how when we have these conversations, start having a conversation that will at least create a vibration. And maybe that vibration will begin to go into a push, because maybe that vibration will get to a person that sits on a committee with a person who sits on another committee who discusses what's on the electronic medical record, how it's designed, what is put where, who gets access to what. Those committees exist within the healthcare system. It's finding out who sits on those committees and who has access to those people. Now, it turned out in the grand round, somebody raised their hands and said, I sit on that committee. And we've never thought about assessing sex on the medical record. And now they get the opportunity. Whether they do or they don't, that's up to them based on their values and their priorities. But I would offer you will, with that simple change, decrease your misgendering. You will decrease patients' discomfort who are gender nonconforming. You will decrease assumptions, especially when patients' anatomy is not what someone would assume based on sex for whatever reason. Whether they're intersex, whether they have surgical changes, for whatever reason. And in doing that, you will improve your ability to deliver medical excellence, and you will improve patient satisfaction, because reassessment matters.